Hi, everyone. I'm Marina Castellanos. I'm a physical therapist here in Westchester County. I specialize in pelvic floor health for women, children, and teenagers. And today I'm excited because I'm going to be interviewing Dr. Carolyn Thompson-Chudy of Pelvic Rehabilitation. And I'm going to let her give you more of a background of herself, and she'll do a way better job with an introduction than I will. So, Dr. Chudy, why don't you take it away?
Thanks so much. I'm a physiatrist, so I have been trained in muscle, nerve, bone, and nervous system function. So my main goal is restoring function, and with regards to the pelvic floor, that includes pelvic floor muscle function, nerve function, and function in terms of bowel, bladder, and sexual function. I was trained at Cornell and Columbia, New York Presbyterian in physiatry, and I did an interventional spine and sports fellowship for which I learned a number of techniques to improve pain in the musculoskeletal system, and I've sort of translated that into the pelvic floor.
Right, and it's so greatly needed. So your practice that you work with, pelvic rehab, I mean, they're really the first large pelvic practice, at least that I'm aware of, that really addresses the population of people who really suffer from chronic pelvic pain. So before, trying to find somebody to send, patients to who I felt needed, further care, it was more challenging. And then when pelvic rehab opened up, it was like, it was so amazing just to have this practice of doctors and physiatrists, who specialize in this area. And most people, if you ask the average person, they've never even heard of a physiatrist. So the fact that, we have physiatrists now who specialize in pelvic health is just, wonderful. And it's just a great resource to give to people. So you mentioned some of the conditions that you treat. What would you say, are your top three conditions that you see at work?
Oh, top three. This is hard because we see such variety. I'd say in females, we see a lot of vaginismus. We see chronic pelvic pain related to endometriosis and adenomyosis. And we also see a lot of pain with intercourse in females. Males, we tend to see a lot of pain related to whether it's low back or SI joint pain. We also see persistent genital arousal disorder and a lot of people with testicular pain.
Okay. So all of those conditions, I mean, they really come under the category of pain, but they're also different, each and unto themselves. So when you do have somebody come in to see you, what does that first appointment look like, that initial session with somebody who hasn't seen you yet? What happens there?
Yeah, so the first appointment is very thorough. We start with a long list of extensive questions, and it can be everything from how your bowel movements are to how often you urinate, what intercourse is like for you, whether it's painful or difficult for whatever reason. We asked a history of gynecologic history, urologic history, all kinds of detailed questions. We also do a physical exam, and the physical exam is also quite detailed, including the low back. We want to investigate the hips, the abdomen, how the pelvis moves. We want to see externally how the pelvic floor is feeling, as well as internally. And we walk the patients through that in order to make everyone feel comfortable, because it is a sensitive area.
It is, and it's so important, I think, to work in a patient's realm of comfort, so that we don't trigger their pain symptoms, and we don't trigger that fear and anxiety that comes along with so many of these, chronic conditions.
Absolutely. And a big component of the first visit really is education and letting the patient know, why you have this problem, and either how it started or how it's gotten so bad, and then what can we do about it? How can we get you better?
Right. And just providing that education, I mean, I'm sure you agree, just providing that education to the patient just almost gives them a lot of relief and, empowerment that, these symptoms, they're not in their head. Maybe they've seen another doctor who said, oh no, you're fine. This is all in your head. And it just, adds to the frustration and the cycle of stress. And, they almost have this gigantic, weight lifted off their shoulders when when I tell them, yes, other people experience this. You're not alone. There's a way to help these conditions, and just to see, that change, in their face is just, amazing in and of itself, because some people suffer with chronic pain for years before really, seeking help, or even, finding out that there is help available and, being guided towards us.
Absolutely. And I would say that probably on average, a patient has had pain between 2 and 5 years before coming to see us. So they've been really struggling for a long time. And I can't tell you how many times the patient will come to us as a new visit and say, someone has sent me to a psychiatrist or a psychologist for this problem, when really they're having physical symptoms. And I have to reassure them that it's not all in their head. There's something that physically is causing the pain or the dysfunction, and we need to address those things.
Right. And pain is such a complex condition, and to really have somebody be told that it's all in their head, it's just pain really does originate in our brains, but that's just so different from when somebody hears it's all in your head. When somebody says that, it implies that you're kind of making this up, or it's pretend, it's not real. So it is in all of our heads, and an aspect that it's, something that the brain is truly connected to, because our nervous system plays such a huge role in chronic pain. But really, so many people suffer needlessly and hold off on seeking treatment, for their physical symptoms, because they were told, this is just something that's in their head and pretend, and, not real and not true. So, what are some of the treatments that you're able to offer some people who come in to see you?
That's a great question. We use a lot of conservative medicine here. So we try to start with the easy things, like the non-invasive techniques, such as particularly physical therapy. When I say easy, I don't mean that going to physical therapy is easy, but in terms of the amount of invasive treatment, physical therapy is on the lower end of that scale. And I'd say, 99.9% of my patients get referred to a pelvic floor physical therapist, because they need to have the structural components of the problem released in order to really make progress. So that's the first step. We can also use a number of medications, both orally. We can use them through suppository form for less side effects. And there's a lot of coordination of care between us, a gynecologist, a urologist, potentially a psychologist, or someone who can prescribe other medications for pain. And finally, some injections if needed. So we really start with sort of that, lower end conservative type treatment, and really advance our way to the more invasive, only if really needed.
Right. And I think that's probably the approach that most people are looking for. They want to go for that conservative approach first. I'm sure there are people who might just want to say, go in for the injections first, but probably, most of the population will say, let's try, going for physical therapy. Let's see, the progress we make with that. And how do you actually collaborate, your treatment with physical therapists? Do you maintain open communication with them?
Yeah, absolutely. So again, sort of to reiterate, physical therapy is paramount in my treatment, and any treatment that I do, I consider as almost an adjunct to what a physical therapist can do for a patient. We need to work together. And so when I see a patient, the first thing I do is ask the patient if I can communicate with the physical therapist. So once the patient gives me permission, I reach out to the physical therapist and let them know my findings and my plan, so that we can all be on the same page. And once we do that, certainly once the patient has been to physical therapy, I'm in constant communication with the patient's therapist.
Right. I think just as healthcare professionals in general, I mean, we're meant to work as a team. We're meant to collaborate because each of us has our different strengths and expertise. So really, you want a team behind you that can, address different things about recovery. Especially from chronic pain. So having doctors who can, call each other, who can contact each other and discuss your case. I mean, it's such a valuable asset just to help you improve and, make progress more quickly. And I know, the doctors of pelvic rehab are so amazing at that. They're really wonderful at, calling and, saying, hey, I have this patient, can you help them? And they're so easy to reach when I have questions for them. So it's really such a great practice that you're part of.
Well, thank you. We appreciate that. And, like I said, we really wouldn't be able to do the treatment that we do without having great physical therapists like you to work with.
Oh, thank you so much. I appreciate that as well. So we're just about out of time, so we're going to start wrapping things up. This was so great, Dr. Chudy. I appreciate your time. And do you want to tell everybody the best way to reach you?
Sure. So the best way to reach us is probably by going on to our website. Again, the practice is pelvic rehabilitation medicine. And, you can just put me into Google, Carolyn Chudy, it's Chudy, and just give us a call.
Okay. Do you have any social media that you want to share with everyone?
I do. I have Pain Free NYC is me, and I share typically just information that can help patients.
Okay. And that's on Instagram, right?
Mm-hmm.
Okay, excellent. All right, everybody. So thank you so much for joining us, and we'll talk to you again soon. Bye.
Thank you.
Okay. And